While the overall compilation of literature addressing LGBT health continues to grow, health concerns specifically related to rural locales have been overwhelmingly understudied. The following presentation will attempt to address the health concerns of rural LGBT communities, given the existing body of knowledge. A study within the past decade determined that 99% of all counties in the United States have at least one household headed by a same-sex couple. While only 3.5% of the population of the U.S. identifies as lesbian, gay, or bisexual, and less than 1% identify as transgender, almost 9% have had sexual interaction with the same sex, and 11% of individuals have some same-sex attraction. This being said, it is highly likely that there are LGBT people living in your community or who are patients at your practice. LGBT people are at a much greater risk of mental health related issues. Enacted and felt stigma, prejudice, external and internal homophobia, and the subsequent fear and isolation that stem from those cause psychological stress for sexual minorities. As illustrated throughout the literature, all of these themes connect back to the concept of minority stress, which points towards the underlying psychological concerns that lead to risky behaviors. Minority stress refers to the mental tension and anxiety experienced by socially stigmatized minorities subjected to discrimination and prejudice. Compounded in rural locales due to geographic social implications, the minority stress experienced by the LGBT community can lead to greater risk of mental health concerns. While some members of the LGBT community are against being referred to as a minority due to its marginalizing connotation, the term in this context remains appropriate since we will allude to psychological concerns directly related to minority stress theory. This concept touches on the idea that stress from social and cultural circumstances, not just personal events alone, can lead to poor mental and physical health. Minority groups, therefore, are subject to increased levels of socially constructed chronic stress. Examples of these minority stressors, which affect the LGBT population, especially in rural areas, are homophobia, internalized homophobia, prejudice, discrimination, isolation, and loneliness. Rurality constitutes an additive effect to the already present minority stress felt in all geographic areas. Rurality has been positively associated with more homophobic attitudes than in urban areas. Homophobia, demonstrated by vehement and antagonistic actions that stem from anxiety, fear, disgust, or discomfort, is maintained by normative cultural sentiments regarding sexual and gender minorities. Rural LGBT residents, in comparison to those in urban areas, are more likely to have been victim of homophobic hostility. Overarching negative attitudes towards non-normative behaviors fosters an environment where LGBT individuals must choose to stay hidden or are forced to out of fear. Research indicates that over 55% of individuals who identify as lesbian, gay, or bisexual, and over 70% of gender nonconforming and transgender patients have experienced discrimination in healthcare settings, ranging from abusive language to excessive precautions, and even outright refusal of care. When getting to know your patients, it is crucial that you don't make any assumptions about their sexual or gender identity. Remember the possibility that you currently have or have had in the past patients who did not reveal their sexuality to you out of fear of discrimination or because of past negative experience in healthcare settings. Minority stress can cause stigmatized individuals to adjust their personal perceptions of themselves or outwardly toward communities to which they belong. Rural communities tend to value traditional gender and sexuality behaviors, such that rurality and effeminate behavior are not cohesive and can have significant impacts on gay men. Research has found that gay men in rural areas are often the subject of stigma due to others' fear of non-masculine behavior. This fear of being perceived as effeminate and outwardly gay is an integral part of many rural gay men's identity formation process. For many sexual minorities, there seems to be a common theme of internal struggle in reference to distinguishing between what it means to be an LGBT individual and what it means to be rural. The conflict between rural identity, which emphasizes heteronormative masculinity, and various LGBT identities, shapes the way in which many individuals form their own identity in response to an oppressive environment. The "don't ask, don't tell" mindset of many rural communities further propagates the necessity for sexual minorities to impose self-isolation. This added pressure of continuously needing to monitor one's own behavior and the attitudes of people around you is a constant psychological stressor for many LGBT individuals in rural communities. As an example, in order to maintain a sense of privacy and avoid homophobic retaliation, rural gay men cling to the masculine aspects of rural identity, often to their own psychological detriment. Touching on a previously mentioned concept, social stigma that causes fear and hatred of one's own sexual identity is described as internalized homophobia. This internalized homophobia, which is exacerbated due to the overwhelmingly heteronormative attitudes ubiquitous to most rural areas, creates a personal struggle over the disconnection between gender and sexual identity and behavior. The stresses of identity formation are very different for the diverse range of sexual minorities, yet the constant linking pressure is that of isolation from other LGBT people. The stress caused by prejudice and discrimination towards LGBT people is also related to high-risk behaviors, such as excessive alcohol consumption and drug use. Higher rates of drinking and other risky behaviors can often be linked to social situations that are specific to LGBT communities or the greater communities in which LGBT individuals reside, such as rural locales. Research has found that rural LGBT youth display higher rates of alcohol use, which is correlated to the negative impacts of homophobia from peers and classmates. Along with the added pressures of extreme homophobia and discrimination in rural settings that can lead to substance abuse, there are also a lack of healthcare providers who are able or willing to deliver proper care to LGBT people. Recent studies that focused on rural geographic locations found higher rates of homophobia were found among individuals with greater religiosity. There have also been specific connections between Christian fundamentalism in the southern U.S. and minority stress felt by sexual and gender minorities. Conservative and religious ideals are the driving forces of much of the homophobic attitudes prevalent throughout rural areas. Christian fundamentalist ideology, which permeates public institutions in the southern U.S., loudly voices the opinion that homosexuality is a disease to be treated. It has been suggested that the profound religious social overtones in rural areas connect directly to conservative traditional values and political principles. These heteronormative attitudes can cause non-heterosexual youth to encounter unsupportive, if not hostile, environments in their rural high schools. Severe social isolation during times of identity development for LGBT adolescents can have a lasting impact on psychological well-being, from mental health, such as depression and anxiety, to substance abuse. Especially in rural areas where fundamentalist and traditional values sway public attitudes of sexual and gender minorities, open and accepting support networks are necessary for good mental health. Minority stress can be lessened by strong community connectedness, and in turn reduce the impact on negative psychological outcomes for LGBT people. Yet, unlike urban areas, rural communities do not have as many resources, such as gay service agencies, gay churches, and community organizations. It's often difficult for LGBT individuals to make connections and form social groups, an issue which is seen in research findings that demonstrate the connection between poor mental health and a lack of social support networks for gay men in non-metropolitan areas. Higher levels of depression due to community attitudes about homosexuality are attributed to geographic location and the corresponding social constraints. Even for those LGBT individuals who are able to create a support network, homophobia, prejudice, and discrimination are still part of a normal life in most rural areas. LGBT people in rural areas are often unable to access adequate sources of mental health care. Barriers to proper mental health care in rural areas include lack of access to providers who are knowledgeable and accepting of sexual minorities, privacy, and treatment options that are geared towards heterosexual normativity. A common yet overlooked problem regarding the attitudes of rural providers towards LGBT patients is that of therapeutic neutrality, which refers to the conscious effort to treat all clients equally. This failure to recognize additional and differing health concerns faced by sexual minorities neglects the need for cultural sensitivity in clinical practice. While mainstream culture is becoming increasingly tolerant, tolerance does not denote acceptance. The problems that LG people face are, in fact, a public health concern, and as healthcare providers, we must do our part to address these issues, which are largely related to discrimination stemming from socially embedded stigma. Fear of this stigma can lead to underusage of healthcare and reduced probability of disclosing sexual and gender identity to providers. Without competent providers, support networks, and an accessible LGBT community, sexual minorities in rural areas are in a constant state of personal and public denial of their sexual and gender identities. We need to move beyond treatment and towards promoting healthy social circumstances that combat heterosexism. This completes Lecture 2. Additional reading material, including the resources used in this presentation, can be found on our resources page under Rural LGBT Literature. Please complete the corresponding quiz and then continue on to Lecture 3.